Go.
Hi everyone, this is Kim McKenzie. I'm here with Dr. Ken Zangwell, and we are here for our 6th town hall meeting. I've been rounding as usual every day, and this week it seems most people have been interested in the budget reduction. So I just wanted to quickly answer one question that most people have been asking, which is what's going to happen with my job? So just to be clear, just to get it off the table, there are no layoffs planned at this point. It's not even being considered at this point. So please stick with us. Don't go looking for another job. We need you here, and that will take me on to my next topic, which is just a thank you so much for the hard work. Everyone's been coming to work and sticking with us, and we are definitely sticking with you. I want to take a quick moment to say thank you to all of our laboratory staff. This is lab week, and let's just say thank you to them. So if you see any of our lab staff around, our phlebotomy staff, just tell them thank you for their hard work too. I think that's it for now. Again, thank you so much for everything you're doing, and we are getting through this quite well, and I'll pass this on to Dr. Zangwell.
All right, thank you very much, Kim. Let me thank the lab as well. They've really done an outstanding job. So I have, as usual, I have a list of things here to talk about. I'll try to get through as many of them as I can. First, surge planning. We have not, I think it's fair to say, we've not really hit a big surge. We've certainly been very busy, and everyone has contributed to that, obviously. In fact, Kim just told me there was a presentation by the modelers. Some of you know Roger Lewis, who's the head of our ED. He was tasked to help the county and the city model and try to predict our needs on ventilators and ICU beds and other things based on an anticipated surge. I haven't seen this presentation. I'm told it just happened, but I was told that the curve appears to be flat here, which is great, and we'll see how it goes in the future. Indeed, if you see the daily dashboard that comes out, I was going to mention that we, at least as of today, we only had 19 COVID positive patients today, which is fewer than I recollect having in many days, and literally 0 PUIs, or persons under investigation. So that's great. So part of that may be the natural dynamic of the disease as it passes through our area, but I will also say it's in part a testament to some of the efforts to transfer patients out of this building. For example, as part of surge planning, there's been an ongoing attempt to transfer COVID negative patients to the USS Mercy, and we've transferred, according to our dashboard, 29 patients to date. And we also have the opportunity to transfer COVID positive patients to something called the LA Surge Hospital, LASH, and we've transferred 8 of those patients over there. And I'm told that this hospital has done an exemplary job in that respect. So we do that to clear out beds in anticipation of the surge. So we've done a fabulous job. Our census has been low, which is the goal. We've transferred patients to other places, and the curve is flat so far. So this is all very good news. All right, part of our effort to prepare and to take care of the patients we do have has been redeployment. Redeployment just means taking one person who works in one area, usually is comfortable in that area and skilled in that area, and moving them to another area of need after they have been trained up to perform the tasks required in that area, of course. And this is a positive comment. Redeployment has gone very well. Many people have volunteered, and others have not volunteered, but were asked to redeploy to other areas of the institution. And I just wanted to list the areas that have contributed to this. And if I miss one, I apologize. I think the overriding message here is that it really has been, according to all the leadership here and a lot of the frontline staff, a positive thing, lots of great teamwork and working together. Folks in many areas have been redeployed, folks who normally work in utilization review, for example, normally work in trauma, quality, nursing, the Kaizen group, ambulatory care network, perioperative group, compliance and accreditation, various doctors. For example, in the doctor side, orthopedics has combined to develop a little team to do proning, which means turning ventilated patients from their back to their front. That's a redeployment. Radiology has volunteered to help the PIC team put in percutaneous central venous catheters. And there are other groups. So I just wanted to publicly really send our appreciation to all those folks that are doing that. It's not an easy business to go from something you're used to something you're not used to. So thank you for that. Another announcement I want to make, which you've seen already, I hope, in various other places, is there is hotel space being provided by the state of California and Los Angeles County through sort of two different mechanisms. If you are exposed, let's say, and you are not unable to self-quarantine in your house for whatever reason that may be, and you are in need of some other place to go while you ride out your exposure, and of course hope to do not develop symptoms, there are opportunities through the state, as I said, and through DHS, as they have a relationship with Airbnb. So if you have this need, you can contact Keisha Bellmaster, who's here on the 8th floor. She's an assistant hospital administrator. Her number is 6349. And this has been blasted out, I think, in the daily blasts, but just know that that opportunity exists. That's really a wonderful opportunity, again, for those that may have been exposed and for some reason can't stay in their house or their apartment. Another announcement, there is a new thing that I just learned about a couple days ago. I think it's just sort of active now. It's a medical legal partnership opportunity from what is called the Social Medicine and Community Health Group in the ED. And I have a flyer here, and if we can get a close-up of it, that would be great. What it is COVID patients have their unique challenges, even COVID-exposed patients, whether it's receiving stimulus checks, unemployment, outright discrimination in a public congregate facility, all kinds of things that happen to folks that get diseases people are afraid of. And I'm just going to post this like this. This is an opportunity for folks to get free legal help should you find yourself in the position of whatever bad position you feel yourself in from external forces and folks that don't understand your situation. And there's contact information on here, Julia Klaus. There's a phone number. The extension is 7205. This is wonderful. Free legal help by phone. That's what it says right here. Okay. COVID testing. Let's do an update on testing. You may have heard, you should have heard, that there is now free testing provided by Los Angeles County. If you are symptomatic with fever, cough, and shortness of breath, you can get a result perhaps the same in the next, you can make an appointment the same or next day. You might have seen tents. They're out by MFI. They're on the other side of campus. It's an oral swab. It's free. You do it in your car yourself. The turnaround time is 2 to 4 days. And yes, I say you have to register, get an appointment, but it will be done, it will be free, and you will get a result. These are for symptomatic LA County residents. The way to get to find that, to register, is to go to a website called covid19.lacounty.gov/testing, or you can Google it, which is how I found it. And I will tell you that website is quite informative. In my humble opinion, it is very clear the folks that are eligible, where to go. It lists 35 or 40 places on the site. You don't have to come here even. What it takes, what it is. It's just really a wonderful website, quite frankly. And I'm also told you can call 211 to get the same information. And I think they're tasked with doing up to 300 to 350 swabs a day. So I think there's plenty of opportunity should you have that need. There is also the opportunity, I will repeat what Erica has said in these town halls before, for symptomatic healthcare workers to be swabbed as well. That's also by appointment. It's through employee health, and they will take care of you. That's also a 2 to 4 day turnaround. And by the way, just you may ask, why so long with turnaround? Remember, if you're symptomatic as a healthcare worker, you can't come back to the building for a minimum of 3 days anyway. And if you have COVID, it's a minimum of 7 days, assuming you're doing well. So the turnaround time doesn't make a lot of difference in that setting. So LA County residents have an opportunity for free testing, and our healthcare workers have an opportunity, of course, for free testing as well. All right. Another issue that's come up that's been a big topic of discussion is N95 respirator sterilization, or reprocessing, or decontamination, whatever you want to call it. So I just want to say that this concept of reusing, essentially, or I should say sterilizing, we have a reuse policy already where you can reuse a mask 5 times, so long as you weren't involved with a PUI or COVID. That's a different issue. But the sterilization of masks is a recommended approach by the Centers for Disease Control and Prevention when your institution or your healthcare system is in what's called a crisis situation with regard to supply of masks. We are not right now in a crisis situation with masks. We are what's called contingency planning. You've seen the little traffic light thing on our dashboard every day. I believe today was yellow. However, even though we're not in crisis mode, we need to plan. We can't just turn on mask sterilization and deployment on a dime. So we are doing exactly that. And there's a group at the DHS level that's been planning for weeks now, including infection prevention and other folks. And I will say that other healthcare systems, believe it or not, are doing sterilization and distribution today. So we're not unique in that sense. You are aware, I think, that we've been collecting N95s for about 2 weeks in special bins. I believe in one of these town halls I showed the bin with a sticker on it. So that's going well as far as I understand. So we're collecting, and we've been thinking about how best to sterilize masks. So I should say that the processes we've considered and chosen, and there'll be an expected practice on this, it's in development, it'll be released soon, I suspect, is, just so you know, science-based, FDA authorized, and as I said, used at several other facilities in the country as we speak. So just know that we're really trying to be as deliberative as possible on this whole topic, because I know it's a scary topic to even think about reusing a mask that you don't know where it came from, but it was sterilized. So you need to know we're trying to do this at the highest levels with the government agencies in alignment and using processes that are known to work. In fact, we've been using one of the processes we're going to roll out already on the 5 West ICU for 2 years as part of our terminal cleaning in that unit as in control, and comparing it to other units where we're not doing it, and it works. That's just our experience, but we don't need our experience to know it works. There's plenty of other data on that. So the other thing you need to know about this whole sterilization concept is that once we do this, the sterilized masks will be not actually deployed directly to us immediately, to our frontline folks or anybody. It'll go right to the disaster cache, which we maintain all the time, because we're not in crisis mode right now. We don't need them today. But should we have a supply that we predict to be less than 8 days, then we will start to roll them out in a deliberative fashion. Let's see. I did get a question for this town hall about whether this process will take away makeup or blood or other stuff that's on the mask. It will not, but we're not even putting those masks into the process. So they're being stored right now. Soon enough, once we have our processes in place, they'll be sorted, and all those masks that are broken or have lipstick or makeup or blood or anything are just going to get tossed. They will not be put into this into the sterilization process. It effectively kills COVID. It's a hydrogen peroxide vapor plus minus gas plasma, depending on the processes we use. Kills COVID dead. It kills just about everything dead. So that's a good thing, and that's well known. And the other thing to keep in mind is that when these masks come back to us, they'll be labeled. You'll actually know that if we get in crisis mode, and if we take them out of the disaster cache, and if they get distributed, which may not happen ever, but if it does, you'll know that the mask was reprocessed, just for your own edification. We thought that was important and transparent. I think that's all I have on mask sterilization. Another topic to bring up, hall monitoring. Didn't stop in high school. We have hall monitors in the building, and what they're really doing, and monitors maybe not the best word, they're helpers, frankly. We've noticed, many of you have noticed, some people have masks on, but they have them on incorrectly. Maybe they don't have masks on. Maybe they didn't know we're supposed to wear masks. So we have 20 or so people roaming around the building, all over the place, explicitly charged with helping people wear their masks correctly. And if you don't have a mask, they'll find one for you. So just know that that's going on, and I'm told by the folks that are leading this that it's going well, and that people, I think, appreciate the help. Let's just put it that way. So we're not encountering, I'm told, resistance from staff. We're encountering, oh, thank you very much, I'll try to do better, and teach me how to do it, and that's great. So it's all part of the community effort to wear masks while we're here in the building. Let's see. So while we're talking about masks, I just want to remind people to not wear PPE in non-clinical areas. You're all aware that we're all supposed to be wearing surgical masks in general, either cloth masks if you're not in a patient care area, or a surgical mask, or an N95 depending on the indication if you're in a clinical area. But the face shield, actually all of the PPE, when you're not doing that, the face shield and the other PPE should not be used outside of patient clinical areas. I've seen people walking around sometimes with face shields or goggles or whatnot. Those really should not be sort of milling about in the general population. Also try to maintain 6 feet of separation. You've heard this, you don't need me to tell you that, and I know it's challenging, frankly. In some offices in the building, it's tough to maintain 6 feet separation, but we've also seen people in line in the cafeteria or other places, and it's easy to not do that. But please be cognizant of that. Have your mask on and maintain 6 foot separation as best as possible. Head covers, please, again, if you have a head cover on, which we do not encourage, please don't wear them out and about. Hot off the presses this morning, while we're talking about this kind of equipment, DHS apparently will be providing cloth face coverings to workforce members who continue to come into a DHS facility or county work location. Even if you do it only intermittently, you might be on telework, but you show up once a week, once every 2 weeks. DHS will be providing cloth masks for you when they become available, but they have made that decision to do that. And they'll start when they get them. What else? I have a couple other questions here. Someone was asking about environmental disinfection. What are we doing about just phones and other things in nursing stations? So we have asked EVS, Environmental Health Services, to increase their cleaning, their general disinfection, and that is happening. So just know that. I've gotten some questions on vaccines and therapies and other kinds of things. There is quite a bit of work going on nationally and internationally in the area of vaccines and therapy. With regards to therapy, I believe I read in a broadcast just today, or maybe the other day, that Eric Darr, who is an adult ID physician here, was asked to participate in a national committee at NIH, which is the National Institutes of Health, as an expert consultant with regards to the development of therapeutics here in this country. So that's fabulous. I will tell you, we do not have right now good therapies, good proven therapies for COVID as of today. But there are lots of studies going on, and we'll see how that goes. Vaccines are even are a bit more far off, but there are even way more trials, 50, 60, 70 countries throughout the world that are trying to develop a vaccine. You may have heard about this on the media. I don't have any more inside knowledge than Tony Fauci does when he gives his discussions. I think everyone in the vaccine world understands that we're not going to have a COVID vaccine anytime real soon. It will be on the order of months before that happens. So, but I did want to mention in this town hall anyway, the amount of work that is going on in the area of vaccine development and therapeutic trial design and therapeutic study is really staggering, and more than I've ever seen in any infectious disease, particularly in such a short period of time. So I don't have any other particular information to relay to you right now. I just want to say that it's been my pleasure really to present these town halls. I hope they've been useful to you. Today you notice it was just me, but we've tried to accommodate the questions that you've provided by having various people here, and I hope it's been helpful. Just because this town hall is over, which it is, please continue to send your questions in to us, to me directly, to whomever you like. Questions get to the right people eventually, even if it isn't sort of a direct line. So please do that, and we'll continue to answer them through our broadcasts, through whatever portals of communication that we have, and there are many of them. So thank you so much.